people with poor posture, right? This kind of deal. That you can see this area, right? So our scapulas will come forward, and also the shoulders come forward, right? You'll see a lot of people rolling forward like this. And this is exaggerated, but this is, like I said, it's very common, very common. So we're going to focus a little bit on the size of the scapula here, try and get a little bit of movement in the joint, and then do some pec stretches from the table. And then also do a couple of chair things as well. Cool. So the first one we're going to do is we're going to internally rotate the arm. Now, sometimes internal rotation here is too much for somebody, so you don't force it. If they can't do it, they can't do it, skip it. Right? But if they can, assuming they can, then internally rotate, or just put the arm behind the back. You're going to slide, so this is the left arm. I'm going to slide my right arm underneath her forearm to the back of her shoulder. Right? And notice I didn't go like this. Right? I came down like this. Now you can do this. This is a shoulder joint stretching technique, but that's not our focus right now. It's more of the upper trap and just a little bit of movement and stretch on the front part of the shoulder. So this is going to be in the back of the shoulder. Your other hand is going to come to the front of the shoulder. Now you can interlock your fingers here if you want, or grab, as long as the shoulder joint is surrounded. That's the point. Right. You have to be a little bit mindful of your posture here, because you got to lean a bit. But you don't want to lean like this. Right? You don't want your back bent, right, and your spine flexed. You want it as straight as possible. So you have to get in a little bit deeper of a stance with your legs. And then your technique's going to be, right, up and down, right, and then rotate. Right, up and down, rotate. So there's a little bit of muscling here, but again, it's not a technique that you're going to do for 10 minutes. Right? Again, it's part of your package. And then you're going to throw in, right, now you know I love working from the corner, right? This is my hub.
Yeah.
Right? You're going to come back home to the hub here, and you're going to press along this edge of the scapula. You're going to press and then lift. Right. You're going to create a little bit of movement in this area as you press. And you can press with many things. Palm, heel, thumb, forearm, elbow. Right. Now the first time you do it, right, gently, small or broad-based contact. Right. Lean, right, for my pressing. And lift. 4. Right? Now you lift just enough to get the front of the shoulder off the table. Right? So I don't have to lift it all the way over here. Right? But just enough to get the front of the shoulder off the table. So this should be a movement. Right? You don't have to come all the way down here, all the way up here. Right? You have some tension. Right, some tension here, off the table, off the table, off the table, right? As you're pressing around, right, on the medial border of the scapula. Right? Now, like I was saying, right, leaning on the table, close to the table, close to the patient, lean. Right? You do this. You can press with your thumb, right, in here. You can dig your thumb underneath a little bit, right? If you can get under there. You'll find different people's scapulas. They're hard to sneak under, and some are not. Whatever. It still needs work for most people. Right. You can drop down and use your forearm. Right. This is really just positional. I'm not really doing anything with it. It's still the same movement. And then you can use your elbow. Pretty strong. Okay? Okay. So, so there's 2 techniques. We'll do one more. We have a pec stretch. Right? So again, shoulders like this. Right? Especially that pec minor gets shortened or tight in here. So we want to stretch it out. Right? So what we'll do is take the hand, right? Back of the head. Now again, we can use our bodies for this, right? So you don't have to lift and use your muscle. You can create a shelf with your belly. Start low, stand up. Right? So I can do most of the stretch with my body, but then it'll feel a little more comfortable, more stable for them if you have your hand here. Again, most of the work is with your body. Right? And again, you look for right? Some tension, so maybe a little bit here. I'll go a little bit more and I'll ask, do you feel that?
Mm-hmm.
Okay.
You can go more of it.
Okay. Now, sometimes it's tempting to do a push-pull thing here, right? So don't smash their face in the prayer. It's really just to hold the hand in place, right? Because as you move stuff around, sometimes people will just move a little bit. So you just want to keep it in place. But usually I'll just, with my tiger's mouth, just kind of slightly grasp the wrist. Keep my hand here saying like stay here, but don't smash their face, right? Yeah, so 30 seconds. Right? And you'll find, just like with other stretching for the neck or the back, some people are loosey-goosey and others are not. Right? So I mean, I have some patients that that's about as far as they can go. Right? So that's where you start. Right? Okay? So think of a package. Right? You could put all these together. You could see that you're kneading, palm and thumb, kneading, doing your thing. Say, okay, I'd like to, I'm going to do this. Arm behind the back, do some pressing and lifting. I'm going to slide into here, and get the upper part, rotate, and then back and forth. Right, you do that 2, maybe 3 times, and then you can go right into a pec stretch. See what I mean? So then it should all flow one into the other.
What did you call the stretch?
Pec minor,
Oh.
pectoral, yeah. Hammy,
Yeah.
pectra, scappy. Cool. Okay? So try to put all that together. Now we're all nice and warm in the upper back and neck. Stick all that together with it. Cool?
Can you show the
No.
the
Sure, say it faster.
how you're covering the shoulder? Because I just couldn't get the right thing.
Sure.
To see what you're
I'll do
doing.
So back, front, and you can clasp here, or you can just grasp. As long as you're surrounding it, up and down, so you can hear them sliding, right? And then rotate, slide, rotate. And get a lot of this upper trap in here, and then pressing. Same thing. Like kneading, once you press, you're in it and you stay in it. Same thing with the pressing. In it, stay in it, lift. In it, stay in it, lift. Using whatever, right? And then. Is that too much?
No.
Okay. So, sometimes it's like babies, right? You discern their cries after a while, like moans, impatience and moaning. Sometimes it's a good moan, sometimes it's a not so good moan.